So the symptoms of osteoporosis are actually, fairly straightforward to discuss because unlike other conditions, osteoporosis is a silent disease. You have no symptoms. There is no bone pain. It does not cause joint pains. Osteoporosis, when your bones are weak, you don't feel that. You get no symptoms. The only time you get a symptom is when you fall and you break a bone and it hurts. That's the first symptom that you get of osteoporosis. So a lot of the times when I screen my patients, they are asking, why am I even doing this test? And I tell them, because we need to look for something that may be there that you don't know about. And that's what osteoporosis is. So a lot of patients confuse osteoporosis with osteoarthritis. They sound alike, but they're completely two different things. Osteoarthritis is the degenerative arthritis in your joint that causes pain. Osteoporosis is your bones getting weaker, and that's completely painless until you break something. If it was a car accident, if it was playing football and high impact, if they fell off a ladder, you would be less concerned about osteoporosis in that setting. But if you had a 35-year-old walking in the mall, slipped and fell and developed a fracture, then you would raise your suspicion of what's wrong with their bones that made them fracture, because typically you wouldn't fracture from a ground level fall at that age. So it's more of the forces of the fracture that raises your suspicion, how high of an impact it is, whether it's from a height or whether from the ground level. Some of the things that makes the clinician aware of a patient having osteoporosis, number one, is their age, if they're older. If you notice that they have what we call a thoracic kyphosis, this is where their spine is a little bit curved. You can see these vertebral compression fractures where the vertebrae are stacked on top of each other normally, one on top of the other. But with osteoporosis, you can get what's called a wedge fracture. So instead of the vertebrae being nice and square, it gets compressed and wedged. If you combine a few wedges, then you get a curvature in the spine. And so that could be something that would raise your suspicion of someone having osteoporosis. The other thing that we typically see may be patients reporting that they're losing their height. You look on their driver's license and they're listed as 5'7", but you see them now and they're 5'3". Why is that? Because over time, as they develop these compression fractures, you lose the vertebral height because it compresses like an accordion, it compresses. So if that happens at each level or significantly at one level, you can easily lose 2 or 3 inches of height. And these may not be things the patient reports to you. Sometimes you do get a patient who mentions that, hey, I've lost a bit of height. I can't reach the top shelf anymore. Other times patients or family members can report that their mother or their father are walking with a hunched over, with a little kyphosis. But other than that, you don't feel osteoporosis. So there are really no symptoms. You just have to observe for some of these findings. When I talk about a vertebral compression wedge fracture, this is the actual vertebral body itself. It is not the disc, it is not the cartilage or the ligaments. It's actually the vertebral body, and instead of it being square, the vertebral body gets compressed. Imagine the bone gets softer, you're able to squeeze it, and you get a wedge shape. So instead of being nice and square, you get a little wedge in that bone. And if you add that on several layers, then you start to get curvature of the thoracic spine. Okay. Osteoporosis can occur even though the cartilage is intact because it doesn't affect the cartilage. It's mainly the bone matrix and the bone strength itself. It's not so much of the bone becoming soft to the point of being like a sponge. The bone is still going to be hard, but it's just a matter of the trabeculae in that bone where the internal forces that bone can overcome are diminished because the trabeculae are no longer as robust and thick as they were when you were young and healthier. With osteoporosis, these trabeculae get softer. So It's kind of like if you sometimes eat a piece of a bread or like a crouton. It's hard to squeeze it because it's hard and firm. But if you were to get rid of some of the pieces in there and then you squeeze it like a wafer, it's just easier to squeeze. So it just depends on the density of that bone. And the density decreases because the trabeculae are lost or they get thinner. We can see it in the lower spine, lumbar area. We commonly also see it in the thoracic spine as well. And that's where a lot of the compression fractures do happen in the lumbar spine. In America, every year we get about 800 to 900,000 vertebral compression fractures. In comparison, we see about 300,000 or so hip fractures. So the vertebral fractures do happen much more commonly than the hip fractures. And a lot of the times they go unnoticed because they're asymptomatic for the patient. That doesn't mean they're always asymptomatic. There are instances where if a patient fell and they landed on their bottom, it could be enough force to cause that vertebral body to collapse, and then you feel sudden pain at that level. And it takes time for that bone to heal, just like any other fracture. When you develop a vertebral fracture that is wedge-shaped, if it happens relatively, new onset and the patient reports it, the doctor is aware of it, there are certain procedures that can be done to balloon and re-inflate, so to speak, that bone. What they do is they put in a catheter with a balloon and they pump that up, and it helps to re-expand that bone, so instead of being wedged, it straightens out again. And sometimes they also inject a little bit of cement in that area so that the bone doesn't collapse again. So that procedure is called a kyphoplasty. And it is done by certain spine doctors and pain management doctors. It doesn't treat the osteoporosis because that you treat pharmacologically with other types of medications, but it helps to address the wedge at that particular level only. It is an invasive procedure to do a kyphoplasty. You numb the area, you bore into the bone with a CT device so you see exactly the level that you're going for on the imaging. So it's very direct, and they use a large gauge, a needle that has a balloon at the tip. You enter the vertebral body and then you inflate the balloon, which opens things up, and then they subsequently inject cement into that vertebral body. Patients are expected to, not be too active after the procedure so that they can rest and heal. But the purpose of doing that is to try to restore the vertebral height, but also address some of the pain that happens after a fracture. It's because of the fracture, all of the trabeculae collapse, so you reinflate it because the trabeculae are already all broken. So you reinflate it and then you put the cement in there to hold it in place. The cement that is injected is strictly put in there to prevent it from collapsing. It does not make the bone any stronger. It does not treat the osteoporosis. There's always small risk of an invasive procedure of some of that cement leaking out, So these are things that are done by highly trained ortho, spine, or neurosurgeons who specialize in doing these types of procedures.